Hello and welcome. Today's presentation is on aquatic therapy. I'm Meg Miller, your outpatient physical therapist. So I wanted to let anyone know watching on broadcast that there will be handouts available in the Commons Fitness Center. You can ask Kira or myself related to this presentation. I have a handout that has a nice synopsis of what we're going to go over today. And then, of course, if you have any questions, you can reach out to me and I can get those answered. So today's presentation is on aquatic therapy and it's entitled, Don't Sweat Getting Wet. So what is aquatic therapy? Basically, it's therapy provided in the water environment. So it's an alternative form of therapy that utilizes a low-impact environment for exercise and treatment. Aquatic therapy consists of a skilled program that's performed in the water with a licensed certified therapist. It provides a comfortable and pain-free environment that facilitates improved endurance and mobility. A lot of times when you're working out in the water, you get a good workout and you don't even feel that soreness until afterwards. Okay, so what's the big difference about aquatic therapy versus our normal conventional land-based therapy? Unlike water aerobics, aquatic therapy is a program established exclusively for you by a physical or occupational therapist. And it will focus on your individual needs and also incorporate specific goals for you to reach. We do require a medical diagnosis that's appropriate for aquatic therapy, and then it must be ordered and approved by your doctor. So why do we use aquatic therapy? It's a beneficial form of therapy that is useful for a variety of medical conditions. I'm going to give you a couple examples here. General weakness or limited endurance, arthritis, healing fractured bones, obesity, swelling, poor proprioception, which is your ability to tell where your body is in space, sprains and strains, torn ligaments, muscle spasms, balance difficulties, and limited mobility. One particular thing that specifically likes the aquatic environment is backs. So I will take a lot of my patients with back pain, especially if it's due to arthritis or, some inflammation around those nerves. I will take them into the water, and when we're in there, we experience that pressure relief on all those joints that can feel really good and allow us to do more. So the properties of the water, there are a couple properties of the water that help to make it an effective place to do our exercise. So aquatic therapy uses the physical properties of the water to address issues such as pain, stiffness, weakness, and loss of balance. I like to say, if you lose your balance in the water, the worst thing that's going to happen is you'll get a little bit more wet than you intended, right? But we don't have that injury from falling in the water because as much as it challenges our balance, it also does protect us a little bit and catch us if we begin to fall. So the main properties of water which are utilized within treatment are buoyancy, viscosity, hydrostatic pressure, and the water temperature. So first we'll talk about buoyancy. Buoyancy is that floaty feeling that you get when you're in the water. And I find that we notice this just as much when you first get in the water as you do when you get out of the water, and you feel gravity kind of come back on to all of your joints as you're getting out of the water. So buoyancy assists in supporting the weight of the participant, and it decreases the amount of weight on each of the joints. So there's a little diagram of the force there, but that buoyant force of the water is helping to take that pressure off. So buoyancy is good for those who are not supposed to put full weight on their extremities, such as after a hip or knee surgery, or sometimes after a fracture, we can get somebody back to, or even even tearing a ligament, we can get somebody back to a little bit of weight bearing without putting their full weight through that joint. So that can really be helpful for healing. Buoyancy is especially useful for patients with arthritis, healing fractured bones, or who are overweight. Again, because that buoyant force is taking some of the pressure off of those joints. By decreasing the amount of joint stress, it makes it easier and less painful to perform exercises and to move in the water. One of the best things we can do is walking in the water, and that buoyant force takes the pressure off of the pounding of our joints as we walk. Many people are unable to tolerate land-based exercise due to gravity and increased force through their joints. When submerged in the water, the buoyancy allows less weight bearing while we're moving. So this slide shows how, as your body is immersed to a certain level, how much pressure is taken off of all of the joints, okay? So a body that's immersed all the way to the neck bears approximately 10% of its body weight. So another way to say that is that's a 90% reduction in how much weight bearing you have through those joints. So that's obviously significant. Now our pool doesn't go that deep, but it goes deep enough that for most people we can get them to about chest height. So a body immersed to the chest bears approximately 25 to 35% of its body weight. So again, that's a significant reduction. And then a body immersed to the waist bears approximately 50% of its body weight. The next property we're going to talk about is viscosity. So viscosity is the thickness of the liquid. So you can think of ketchup versus Coca-Cola, right? They're both liquid forms, but they have a different thickness to them, right? A different consistency. So that viscosity of the water provides an excellent source of resistance. It allows for muscle strengthening without the need for weights. And it also allows a person to strengthen muscle groups with decreased stress to the joint. And you get a 12 times greater resistance to movement in water than you do in air. The next property is hydrostatic pressure. So hydrostatic pressure is the force you feel while you're in the water. So that's the force you feel pressing in on your body from the pressure of the water. So you feel it against the body's surfaces. So this force improves proprioception, which is the awareness of where your joints are in space, and the perception of movement and spatial orientation, where you are in space. Hydrostatic pressure helps to decrease joint and soft tissue swelling that results after injury or due to arthritis. It can also be helpful in things like lymphedema. Again, where we have that swelling, that edema in a certain area, that hydrostatic pressure is going to function a lot like a compression garment for the time that you're in the water. Hydrostatic pressure helps slow down movements, which helps in the relearning of physical actions required to make certain movements, such as walking. So the hydrostatic pressure is one of those forces that really helps in somebody, for example, after a stroke, when they have to kind of learn how to walk again, they have to learn their walking pattern again. That hydrostatic pressure, that force against their body as they're moving through the water is really helpful in slowing it down and helping them to relearn. And then as we talked about, that increase in proprioception can be really helpful with neuromuscular disorders as well. Okay, and then the water temperature. This is something that you might not think about as a variable that's very important, but it is. So if we think about, we need things to be either at our body temperature or a little bit higher to warm us up, right? At our body temperature or a little bit lower to help cool us down. So the therapeutic temperature for most pools is between 82 to 92 degrees. And it depends what you're working on, what you're having people use the pool for, whether you want it towards the one end or towards the other. So warm pool water allows for an environment that helps in assisting in relaxing muscles, decreasing muscle spasms, relieving pain, increasing range of motion, opening blood vessels, which increases blood flow to injured areas. Okay. And then we talked about the hydrostatic pressure, again, another piece to go along with, okay, we're opening the blood vessels and increasing blood flow with a higher temperature, but with that hydrostatic pressure and its ability to kind of squeeze towards the body, then we're also getting a better blood flow return towards the heart from that pressure too. So lots of benefits to our blood vessels and our circulatory system from being in the water. Everybody always says they want the pool a little bit warmer. And I hear you. When you first get in, you're like, ooh, feels a little chilly. But we have to remember there's too much of a good thing sometimes. And if we have that pool temperature set too high, then we're not going to get quite as much of some of these benefits. Sometimes if we have the temperature too high, the muscles are going to be too relaxed. And it can then cause us to move through more of a range of motion than would have been comfortable in cooler water. So those are all things to think about. Okay, some additional benefits to aquatic therapy. It's also useful because the properties of water provide an environment in which a person can practice walking and balance without the concern or fear of falling. Like we talked about, you might get a little more wet than you intended, but you're not going to actually fall in the water. The water will catch you to some extent. And then there's some good benefit for addressing pain. The tactile element of water, again, mostly that viscosity, produces a calming effect by increasing relaxation and decreasing pain sensitivity. Again, that warmth of the water will help with that too. This is known as the phenomenon of pain threshold theory. The central and peripheral nervous system becomes less sensitive, resulting in an increased pain threshold and allowing for increased pain-free movement, which carries over, once out of the water. We use that pain threshold theory a lot in physical therapy, and one of the ways we see it used also is through electrical stimulation. And when we have that constant sensation there, and then we take that away, that pain threshold is still higher for a short period afterwards. Very similar in the water. And I think something that helps with that as well is that hydrostatic pressure, because you're getting constant sensory input, right? Your body feels the water around it. And that sensory input can then also work through this same pain threshold theory. And because we feel the sensation of the water, we don't feel as much pain. So pretty neat. We got to kind of trick our brains sometimes. Okay. The buoyancy of the water helps by decreasing stress to painful joints, right? We talked about that reduction in weight bearing through the joints. Reducing the weight of a person by up to 90%. Again, that's if they're up to their neck. Depending on body composition, muscular strength, and depth of water, which we discussed earlier. The warm temperature of the water allows for the relaxation of muscles, which makes movement less painful. And warm water temperature also opens the blood vessels, increasing blood flow to injured areas, which helps to lessen pain and then also promotes increased healing. Okay, so now we're going to talk about improving balance. So improving one's balance is facilitated by the ability to make the correct movements and also reactions, while also recognizing incorrect positions and being able to correct them. The pool provides an excellent environment in which to work on the needed movements and reactions. Like we talked about, again, there's that input, that sensory input on your body from the water. And that helps you to know a little bit more where you are in space, that proprioceptive piece. And so the water's constantly giving you feedback as you're moving, and that can be really helpful. Added support of the water helps encourage free movement, allowing for the learning of movements needed to maintain various balance positions. With aquatic therapy, individuals with balance disorders do not have to worry about falls. They can focus on the task at hand, getting better. The resistance of the water helps encourage free movement. Individuals who move their limbs and trunk through the water elicit greater awareness of how they are moving than if they were moving the same body parts through the air. This increased awareness helps to learn the new reactions needed to maintain balance. We talk about posture a lot, and I've been doing a lot of posture-related therapy, and I'll be doing another presentation at some point that I need to put together on the new postural alignment therapy that I've been doing. But we always think about posture in terms of, oh, okay, I've got to get myself back and I've got to hold here, right? But one of the reasons why that's so difficult is because we don't have a whole lot of proprioceptive input from the air around us, but we do from the water when we're in the water. So that can be really helpful for just telling us where we are in space and then helping us to maintain that appropriate posture. So we have more reaction time in the pool because individuals have an elongated period of time in which to respond to loss of balance episodes. You kind of fall in slow motion in the pool, right? In the water, individuals are surrounded by a viscous fluid, which slows the speed of movement. This viscosity prevents rapid falling and extends the period of time in which an individual can react and correct movements needed to improve overall balance. So again, if you're able to slow that down and focus on, oh, I'm catching myself, you can focus on the mechanics of that if it's slowed down a lot easier than you can on land, and then also with less risk of injury. So now we'll talk about neurological disorders. So individuals who have Parkinson's disease or have had a stroke may have deficits in motor control, which can contribute to difficulty with mobility, balance, and safely completing their activities of daily living. They might also have a higher occurrence of painful shoulders and backs as a result of muscle weakness and tone associated with the abnormal muscle control. Increased awareness of motor control is easier to access in the water because moving our body parts through the water generates more body awareness that enhances better posture. The continual adjustment to the dynamic water environment heightens body awareness and enhances motor control during walking or performance of self-care tasks. The water slows our movement, allowing a prolonged response time and providing sensory feedback. This helps to enhance motor control, such as tremors or shuffling gait associated with Parkinson's disease. And it also addresses increased muscle tone as a result of a stroke. Like we talked about, that warm water is going to help those muscles to relax. The buoyancy or weightlessness combined with the resistance created by movements in the water help to improve muscular strength and endurance, right? It gives us more resistance without having to add weight. Water assists movement that may have become weakened due to neurological conditions. And this support provided by the water allows for greater range of motion with less effort by the individual. So it can be a way to increase our movement in the water. And then eventually, once we've increased it in the water and then had some resistance against it, gained a little bit more strength, then we can translate that motion better to a land-based program where we use weights to resist it further and to strengthen further. The same movements in the water can then be strengthened. That's what I just said. The goal of aquatics as a therapy intervention is to utilize the properties of water to facilitate improved functioning outside of the pool, right? We always want to correlate what we're doing during a treatment session to what we want to achieve outside of the water, right? And it's the same thing. We always want to correlate what we're doing in the gym to what we want to accomplish outside of the gym. We don't walk around throughout our day doing our exercises in the same way that we do them in the gym. We use the muscles differently when we walk and when we do things throughout the day, but we've always got to be mindful of that correlation and how is this thing that we're doing in the pool going to facilitate doing X, Y, and Z outside of the pool. The use of aquatics is just one of many tools that therapists can use to address your unique needs. Aquatics can be used alone as a treatment intervention or in conjunction with many other treatment interventions. Sometimes we'll do, 2 days in the pool, 1 day on land. Again, with the goal being eventually we get you out of the pool and doing more land-based things. And once you have a program you're comfortable with, going in the pool, doing it on your own, and then advancing things on land. All right, remember, don't sweat getting wet. And you can contact the therapy department if you feel this type of therapy would benefit you. I will say also that it doesn't necessarily need to be a full course of aquatic therapy, right? We talked about progressing from aquatics to land-based therapy. But even if you just want to know, hey, I like to go in the pool. What could I be doing in here that would be the most beneficial for me? How could I maximize the time that I'm using in the pool by doing things that are going to translate to land movements for me? What am I going to get the most benefit out of? So I can also do sessions where, we're pretty much just doing it once or twice together and then you do it on your own, right? There's a lot of customization available. So please let me know if anyone has any questions. And as I said, the handout is available in the Commons Fitness Center. You can ask Kira or myself for that. Thank you so much for attending today.